Pregnancy. A healthy diet before and during pregnancy is an important public health goal since it has a significant impact on infant health, maternal health, and overall pregnancy outcomes. The two main goals for a healthy pregnancy are a gestational period lasting 37 weeks or longer. When we think of pregnancy, we usually think of 9 months, and 9 months is equivalent to 40 weeks. But after 37 weeks, the fetus is considered to be very viable and will not have significant health problems if it's a healthy pregnancy. So 40 weeks is a full-term infant, but we want the pregnancy to go beyond 37 weeks. Another goal is birth weight more than 2,500 grams or 5.5 pounds. Preparing for pregnancy. Couples who plan on having a baby in the next 6 to 12 months should begin to modify their lifestyles now to improve their chances for successful pregnancy. The woman should be as healthy as possible before pregnancy, since the embryo undergoes rapid growth and development in the first trimester. And one of the things that a woman really needs to consider is when to get off birth control pills if she's taken the pill, so that her body's hormone levels can adjust. Pregnancy is broken up into 3 distinct trimesters of about 13 to 14 weeks each. The gestational period for humans is 40 to 42 weeks. Now remember earlier I said 40 weeks would be a full-term pregnancy? Well, sometimes baby are very late. And I can say for an example, I was 42 weeks baby. So I came out healthy and really, really big. Actually, I was a 10-pounder. So in preparing for pregnancy, before conception, the woman should quit smoking, stop using alcohol and any illegal drugs, and that would include marijuana, even though it's legal in many states. Limit the use of over-the-counter medication. Reduce caffeine intake. Eat a healthy diet and get to a healthy weight. If you're overweight, get your weight under control, and if you're underweight, put on a little bit of more weight to prepare for that pregnancy. And exercise regularly. Exercise is important for a healthy pregnancy. Now, we don't want to leave the men out of this. Men should also focus on their lifestyle by eating a healthy diet and stop using tobacco and any illegal substances. Men who drink should do so in moderation, no more than 2 drinks a day. And actually, studies show that alcohol and other toxins in the weeks before conception may damage the sperm's genetic material. So we're not trying to be hard on the dad just to be hard, but because we also are concerned about sperm quality. Adverse pregnancy outcomes. These are negative outcomes of pregnancy. So the first trimester is the most critical phase of pregnancy because of the rapid growth and development of the fetus. And most miscarriages are likely to occur during the first trimester. And actually, if it occurs real early in the trimester, some women may not even know they were pregnant. It may manifest itself as a really heavy period. The most severe adverse pregnancy outcomes include stillbirths and miscarriages, preterm infant, low birth weight infant, birth defects, infant disability, and maternal mortality. Let me pause here and say, even though pregnancy is a natural phase of a life cycle, women do die as a complication to pregnancy, and maternal mortality rates are especially high among Black women. A low birth weight or LBW infant is at risk for long hospital stays, diseases, developmental delays, disability, and sometimes death. And that's the reason why we want a baby to have enough weight that can help with survival. And a low birth weight infant weighs less than 2,500 grams at birth, and that again is less than 5.5 pounds. Now, we also have babies that are considered to be very low birth weight, and they weigh less than 1,500 grams at birth, which is about 3.3 pounds. We also have babies that we considered small for gestational age, and this would be a full-term infant who weighs 2,500 grams or less, and for some reason, the infant was stunted in utero. So we say sometimes that baby had stunted growth, a full-term infant, and still weighing less than 2,500 grams or 5.5 pounds. Infant mortality is used to compare the health and well-being of populations across and within countries. And the infant mortality rate or death rate is the number of infant deaths per 1,000 live births during the first 12 months of life.